Toxicity removal. Cleaning up the body burden. Although the ATMC Holistic Detox Program has many components, the core involves the sauna and glutathione. It is not specifically the sauna itself that is doing the detoxing. It is the administrations that are given. The administrations without the sauna would still be effective, as elimination would happen by way of the colon and urinary tract. Sweating gives the body an additional elimination pathway for the toxins we are coaxing out of the body with the administrations. Sauna, without the administrations, would be largely ineffective. If you are approved to do 2 hours of sauna, then you should focus on that and the glutathione. So if a person is too sensitive for the sauna, they would still receive benefits from doing the administrations and the adjunctive therapies in the back room. The other therapies would be the focus for the more medically sensitive and for those who are achieving a 2-hour sauna program. Bioaccumulation. Any toxicity that can accumulate in the body must somehow bind to body tissues, also called bioaccumulation. The most common area to store poisons is in the fat, as the vast majority of toxins are fat-soluble. Fatty tissues include fat, nerve, brain tissue, and the cell membrane of every cell in the body. Toxins deposited in the brain and in cell membranes can obviously do a lot of damage to how we think and function. Another binding possibility is polarization. This is when a positively charged ion, like a mercury ion, binds to a negatively charged tissue binding site. This type of binding then prohibits the binding of essential minerals and can often produce a lot of destruction, as was shown in the Calgary Mercury video. In order to get these toxins out, they must be converted. Just like you would not pee out fat, the fat would have to be converted into a calorie first, and then it could be eliminated. Similarly, the toxic body burden must be biotransformed to be eliminated. Biotransformation. The natural process of converting out these toxins is called biotransformation. Biotransformation processes will result in a neutralized, water-soluble product that can be expelled by the kidneys, the bowels, or sweated out. Biotransformation often uses enzymes. Enzymes are substances that break down complex chemicals into smaller, more simple products. Every toxin, from alcohol to aspirin, must be broken down by enzymes in the liver. Biotransformation consists of 2 steps. Phase 1, bioactivation, and Phase 2, conjugation. Phase 1, bioactivation. The body, using primarily cytochrome P450 enzymes found in the liver, converts a toxic compound into a reactive compound. These reactive compounds are typically more dangerous than the original toxin and can cause cell and DNA damage. The functioning of the detoxification enzymes is specific to each individual and largely depends on genetics. There are more than 50 CYP450 enzymes, but the CYP1A1, 1A2, 2C19, 2D6, 3A4, and 3A5 enzymes are responsible for 45% of drug metabolism. Polymorphisms. These enzymes are responsible for detoxing environmental poisons as well. And genetically, not everyone has each enzyme. If we didn't get the enzyme, it is called a single nucleotide polymorphism, also known as an SNP. So we can get these enzymes from mom, dad, or both. If we didn't get the enzyme from one parent, it is called a heterozygotic polymorphism. And if we didn't get it from either parent, it is called a homozygotic polymorphism. Homozygotic polymorphisms are much more impactful and can be debilitating. People with more pronounced polymorphisms may notice that they are medication sensitive. All persons have genetic polymorphisms, and what we are given genetically is the hand we are dealt. We can play our hand well, or we can play it poorly. Our goal is to help you play your hand expertly. The ATMC detoxification program at the Detox Shop takes into account most of the genetic polymorphisms by giving supplements that are bioavailable. Many people have issues with B12 or folate metabolism, and we give the bypass for that to everyone by using methyl B12 and methylfolate. Some people, especially people of Northern European descent, have issues with fatty acid metabolism, such as in breaking down flax or other grain and nut oils into essential fatty acids. For this reason, we use fermented cod liver oil as it is the most bioavailable. Even vegans who are symptomatic should consider this. We use techniques to bypass blocked methylation pathways, which is a main detoxification mechanism. Many people have issues producing or utilizing antioxidants, which is why we give high-dose vitamin C, R-lipoic acid, and nebulized glutathione. Some people cannot mobilize toxic heavy metals, which is why we use chelation. Much of what we do involves routing around the most common handicaps, and in doing so, even people who do not have those handicaps still benefit. Many times, Through history, you can pick up clues about a person's genetics. For instance, certain bipolar presentations may be associated with an enzymatic inability to break down dopamine, which is called the COMT polymorphism. COMT stands for catecholamine methyltransferase enzyme. You could then give a natural product called BH4 to help with that. If a person is, let's say, Native American or Asian, they typically cannot break down alcohol as they may lack the CYP2E1, and the alcohol will have a much more profound effect. Some people cannot break down the polyaromatic hydrocarbons in cigarettes and are much more prone to cancer. Many of us cannot break down certain psychiatric medications based upon our genetics, and prescribing these medications in the absence of genetic testing is truly a game of Russian roulette. And so what we can't break down tends to accumulate. For instance, when someone with a double SNP on the CYP2D6 takes an antipsychotic, there is a possibility that they develop tardive dyskinesia. Tardive dyskinesia is a horrific and largely irreversible movement disorder. And even though the drug companies are sued for hundreds of millions of dollars by people like Peter Breggin for such reactions, they still make many billions of profits and continue blindly prescribing the medication. Phase 2. Conjugation. Conjugation means with joining. This process takes the reactive toxin from phase 1 and neutralizes it so that it is water-soluble. Conjugators include methylation, sulfur groups from sulfur-containing amino acids such as taurine and cysteine, glutathione, glycine, glucuronide conjugations, and NAC. And some people have genetic inabilities in conjugation as well, which likely account for many health and mental health symptoms. These genetic inabilities are also called polymorphisms. The ATMC protocols are designed to improve biotransformation and to navigate around most genetic polymorphisms. Chelation. All poisons in the body, including heavy metals, are subject to biotransformation. Heavy metals can also be routed out through another process called chelation. Chelation means claw-like, and these compounds grab heavy metals and wrap them up in a cage-like molecule and export them from the body. Chelation will also remove essential minerals, and when doing chelation, those minerals have to be flooded back into the body. Chelation without remineralization could make a demineralized person feel worse, and it is why our program focuses on mineralization heavily in many areas of the program and diet. Chelators can be given orally or in IV. We prefer orally and use a product called DMSA. Oral has about 1/2 the effectiveness of IV, but considering our reasonably sensitive population, oral administration is the most practical. Chelation based upon body weight is performed 3 out of every 14 days. Like with any detoxification effort, the poisons are better out than in, but you want to gradually remove them so as to not overwhelm the person. Chelation will dump heavy metals that are safely bound to the chelator into the gut and urine. Many patients feel nothing at all, and some may feel nausea, fogginess, or a bit tired. Many feel immediately improved. Most symptoms are mild and of short duration, and as with any facet of the ATMC program, adjustments can and will be made to accommodate your unique tolerances. After 2 hours, minerals are given to replace those removed by the chelators. For some, chelation should continue after leaving ATMC. Ask the medical team if this is the case for you. You can find a chelation doctor by going to acam.org. In fact, there you can find doctors who are very likely coming from the same perspective as us to continue your care once you leave. After going to the web link, click on Resources, and then find a provider with Physician Link. Set the radius for how far you are willing to travel and enter your zip code. From the list that is generated, you can click on a name. And then you will see the services they provide. Amalgam removal. Mercury is notoriously associated with insomnia, OCD-like ruminations, and anxiety. If you have mercury fillings, you should consider the removal. You will still benefit from the ATMC program if you do not remove them, as we are getting a good start on the body burden. The teeth, over time, will likely leach out again, and the symptoms may eventually return. These are some things to consider with removal. Enlist a holistic dentist, not just your average dentist. Ask if they use a dental dam. Work in quadrants. Do not remove a whole mouthful in one shot. Ask if they use a nasal cannula so that you breathe only through your nose. Sauna program. The sauna program includes conjugation and chelation administrations. Remember, conjugation converts all types of toxins, and chelation is specific to metals. The sauna program also includes many antioxidants like vitamin C, R-lipoic acid, and glutathione to neutralize toxins. Each day, the participant will be checked in, which includes taking a blood pressure and a review of symptoms from the daily symptom survey. Then, the initial toxin removal administrations are given. Included in this first cup is niacin, which may cause a flush. The flush is a bit of redness on the skin that may feel itchy or like a light sunburn. This phenomenon is normal, and what is happening is that histamine is being released from white blood cells and dilating blood vessels. This actually helps to move nutrients and toxins around on a capillary level. Next, the person will exercise for 20 minutes. The goal is to double the heart rate. This increased blood pressure will further drive nutrients into the capillaries and tissues and drive out toxins. Exercise is truly one of the most valuable detoxification applications that you can incorporate into your program. After exercise, the participant will sit in the sauna for up to 2 hours, with breaks about every 15 to 25 minutes. It is very important that during this time that you drink enough water, with the minimum being 64 ounces and the maximum being 128 ounces. You will also be consuming electrolytes, like the Himalayan salt water, to replace those lost by sweating. It makes little difference if you choose the infrared sauna or the thermal one. As long as you are sweating, that is all that is required. Many persons have to work up to 2 hours, and some cannot do the sauna program at all. If you are approved for 2 hours of sauna, then that and the nebulized glutathione are what you should focus on. Many of the other modalities, such as massage and foot baths, are for those who are too delicate to endure a full program. Nebulized glutathione. Glutathione is called the master antioxidant and is abbreviated GSH. It works to neutralize the major poisons we are faced with. It cannot be taken orally, as it will just break down into its components. And if a person does not have the genetics to synthesize adequate glutathione levels, then taking the precursors could be less than effective. GSH can be given through IV, topically on the skin, or by nebulization, which is breathing. Typically, we use the nebulized method, which also can be combined with the ionic foot bath and a castor oil pack. This delivers the glutathione directly into the bloodstream. It is mixed 50-50 with a bit of saline water. This is a highly safe administration. If someone is allergic to garlic or other sulfur products, then this should be reported prior to use. Being allergic to sulfur-containing foods is different than being allergic to sulfur drugs. If the process has you feeling asthmatic, you may be sulfur sensitive, and you would stop and report this to the supervising staff. Ionic foot baths. The ionic foot bath will set up a negatively charged current in the water, which will, in theory, pull positively charged ions out through the large pores in the feet. The spectrum of potential toxins removed in this way is limited to polarized compounds, which means ionically charged. This method is not a broad-spectrum detox like the glutathione, which is inhaled during the foot bath process. Castor oil packs. Oil and water do not mix, but oils and other oils do. Castor oil is an oil that can potentially pull fat-soluble toxins into it. This is a naturopathic remedy, and the castor oil pack is placed over the liver area with a hot pack so as to draw out fat-soluble toxins. It is usually done in conjunction with the foot bath and glutathione. Gut-brain connection, the microbiome. Why did we not have the mental health epidemic 50 years ago that we see today? To get closer to an answer, we may want to take a look at what we have been eating in the last 50 years. Most of what we think and feel actually originates in the gut. 90% of neurotransmitters originate in the gut, and 70% of the immune system. This system is called the microbiome. The number of bacteria in your gut outnumber the cells in your entire body by 10 to 1. And these type of bacteria have been around for millions to billions of years longer than we have, and have therefore evolved in a very specific way. Typically, medical professionals treat the brain to achieve balance. But if most of our brain's neurochemicals are produced in the gut's microbiome, wouldn't we want to put our attention there? The latest mental health research, particularly from the American Gut Project, is confirming that the gut is highly implicated in mental disorders. It is likely that they have not solved mental health problems with psychiatry because they have an entirely misdirected focus. Some of the first studies with the gut-brain connection involved fecal transplants in rats. These poor rats. Basically, researchers took the fecal matter from an extroverted rat and put it into the colon of an introverted rat. Surprisingly, the introverted rats became extroverted and outgoing after the procedure. This set off a cascade of further research. Basically, bacteria, viruses, and molds like Candida in the gut use neurotransmitter analogs to create cravings and alter moods in a way that supports their survival and not necessarily ours. So sugar cravings, carb cravings, and even drug cravings can be attributed to chemical changes created by gut bacteria. To correct this, there is a two-pronged approach. Kill off the bad bacteria and then populate new healthy gut flora. Killing off the bad bacteria is achieved by a combination of starving out the bad guys and feeding the healthy ones. The diet that we maintain at the Alternative to Med Center serves the purpose of altering the composition of gut flora so that you can get filled up with the correct bacteria that will then send healthy type survival signals to the brain. We eliminate wheat and dairy for this reason. Please choose to add the probiotic fermented foods to your meal. Also, one of the basic tenets of the ATMC diet is to wait 4 to 5 hours between meals without snacking so that your body will scavenge the mucoid plaque off of your intestine. Mucoid plaque is essentially rotting feces that harbors bad bacteria. The 10-day optional challenge accelerates this process. The 10-day challenge shifts the metabolism to digesting healthy fats and super accelerates the establishment of a healthy gut-brain connection. And it makes it much easier to maintain a healthy weight. The 10-day challenge can be something you can repeat at home at 3 to 6 month intervals so as to keep your microbiome in tune. Ask a staff for a copy of the ingredients in the smoothie if it was not already provided to you. Ozone. Ozone is a potent oxidator. Viruses, fungi, and certain bad bacteria cannot live in an oxidative environment. Our own cells use enzymes such as superoxide dismutase to protect themselves and are unaffected by the ozone. We use both an ozone sauna and another process called insufflation that is combined with a colonic. This is a fantastic adjunct to the diet, as the ozone will further kill off the bad bacteria in the colon. Though most persons generally report an almost instant improvement in the way that they feel, it is not uncommon for a die-off reaction to occur. This is where the last dying gasps of the bad bacteria are sending every signal to the brain and gut so that they can preserve their survival. If you get a reaction from the ozone, this is what is happening. This treatment is optional, but it particularly is advised for those with gut issues and chronic infections. Colonics. This is an optional therapy called colon hydrotherapy. It is further directed at the colon to assist with gut emptying, which is called motility. As other processes in the program are liberating toxic body burden on a cellular level and dumping that burden into the gut, we want to make sure that it is going all the way out. The colon is filled rectally with warm water and then released. The water exits through the machine and then the colon is filled again. This process also expands and contracts the colon, which can assist in resetting peristalsis. Peristalsis is the normal contracting and relaxing of the colon, which is what moves the fecal matter through your bowels. Colon hydrotherapy is optional. Probiotic inserts. As they say, out with the bad, in with the good. And in the case of gut-brain health, this is very important. Good bacteria can send favorable neurotransmitters to the brain and elicit healthy food cravings. Probiotics at ATMC are delivered orally and as an insertion after the colonic. It should be remembered that a poisoned physiology, such as in the case of mercury and pesticide toxicity, cannot maintain a healthy gut flora. Deliberate efforts will have to be directed at cleaning up this burden, which is the major focus of the biotransformation and chelation processes. Probiotics landing into a toxic gut will have a similar effect as trying to grow seeds on toxic soil. Major principles of detox. Even after you leave treatment, there are some very, very basic rules of a detoxification lifestyle. Organic food intake can reduce your overall toxicity by 80%. Include major antioxidants such as vitamin C, R-lipoic acid, coenzyme Q10, NAC, and glutathione. Include minerals, specifically trace minerals, as we are in a mineral-deficient society. Sea vegetables are a good source. Essential fatty acids with one of the best being fermented cod liver oil, but also coconut oil and olive oil on food. Biochemical individuality. As you can probably tell by now, this environmental medicine art can be very complex. What makes it the most difficult is because everyone is different biochemically. Often, what you may think is the right thing to do, at times can be the wrong thing. We at ATMC have an advantage in that we are residential. We can see what works and what does not work in real time, and can make rapid adjustments and detect things that would be unavailable to an outpatient doctor. We need feedback from you so that we can make the adjustments necessary, so that by the time you exit, most things have been dialed in, so that you can live the premise of detoxification as a lifestyle and carry the understandings forward in your life so as to avoid the same pitfalls that may have brought you into treatment. Thank you for making the investment in yourself and radiating these understandings to others.